All right, good afternoon. I'd like to start by asking you to remember a time that you went to the hospital with someone you loved in a pretty dire situation. Might have been a heart attack, might have been a car accident, might have been a sick child. Take a minute to think about how you felt at that time and how hard it was to do the simplest of things. Find a parking space, the room that you're looking for. Everything becomes so much harder because when we're under stress, especially in a hospital, we become impaired and we're not able to do the things that we're able to do every other day. Hospitals are very complex. The big ones are bigger than ever, or the new ones are bigger than ever. The old ones are patchwork together and very, very complicated. There's lots of opportunities where we can make this so much better and really impact the patient experience. What if we're able to show people where parking was available before they even got to the hospital, maybe even days in advance before they got there? You know you're going to the clinic on Saturday, it's only Wednesday, you want to know where you can park closest to where you're going inside. If you're just to take Google Maps, they would deliver you at the front door, which actually might be the farthest point away from where you're going inside the hospital. Now, once you arrive, having the ability to know where you parked, mark that off, get directions to the clinic you're going to, and then maybe they're running behind. So they send you a notification because we integrate with the nurse call notification system. Hey, we're running 15 minutes behind. Buy a coffee on us, and here's the directions to go get it. These are the types of things that really impact the patient experience. And this is just a small subset of what's possible when you have indoor maps connected with things like indoor positioning and be able to dynamically change messaging based on what's going on at that time. On the other hand, or the other side of the coin, let's think about the care provider and what they go through and the challenges that they have in a day. So maybe that same person that was trying to help out your loved one is looking for the life-saving piece of equipment and it's not where it's supposed to be, or it's broken, or it's dirty. They go through a lot of stress too. And it's about the time that they spend looking for things and the inefficiencies that could be saved, that all that time could be spent on delivering care and improving patient outcomes and staff morale for that matter. This is a problem. This is what a lot of hospitals today are dealing with. We've got CAD drawings or really overwhelming maps, basically reserved for people who went to university for GIS or specially trained. There's no standard for indoor spatial maps. They're hard to manage, and they're certainly not dynamic. On the other hand, we have tabular database here. This is what somebody's supposed to read from and be able to derive information of where equipment is, what its status is. It's very hard to digest that information. The way that Jibestream looks at a map is very different. We look at it as in layers and objects, and all of it is addressable with real-time data. So we've got your geographical map, we've got your floor plan, and on top of that, we have things like integrations for patient flow, temperature monitoring, clinic wait times. All of this can be integrated into one map and shared across the organization for lots of different purposes. So let's have a look at a couple. Instead of that tabular database, we can have something that's contextual. Take all that information, put it on a map. We can have the status and the location and the general availability of where all the assets are. Now, we're not the RTLS company. What we're doing is we're taking all that data and we're contextualizing it on a map so it's easier to digest that information. Other use cases could be bed management. Again, being able to show people where things are, what's happening. It can also be things like business intelligence and analytics for the hospital. So hand hygiene compliance. And when you start to see information on a map instead of out of a database, you start to find insights and trends that you wouldn't normally see. So, hey, why is it better compliance in this area of the hospital than this area? And you can start to make inferences and figure things out. Clinic wait times, so being able to visualize that in a dashboard, quickly looking at what's going on around the hospital in terms of wait times. And then unfortunately today we have urgent situations such as active shooters. So being able to close off an entire area of a hospital and give a safe route for the security guards and the paramedics to arrive on scene, while also ensuring that nobody else comes into that area. In other situations where the hospital has to be evacuated, all wayfinding leads to the egresses, and everybody's getting the fastest way out of the building. So again, these are the types of things that, when we talk about compliance and security and patient experience, we have the ability to impact all of these things just by adding spatial context and maps. We call it indoor intelligence because it helps you communicate, collaborate, and connect more effectively, not just for patients, but across the entire organization. So essentially what we're doing is we're giving you a way to embed maps into any app or interface you have. We deploy it through an SDK, either web, Android, or iOS. We take your existing apps, whether they be mobile or desktop, and we're able to take a lot of data and bring it in context of a map so it's easily digestible and easy for people to use, no matter whether they're on stage, patients and visitors, or off stage being your clinicians and caregivers. So last year was the first time we actually had a name for this, finally. Gartner put it on the hype cycle. They're calling it Experiential Wayfinding. And it's basically part of this innovation trigger because once you have maps and indoor location awareness, it's the foundational layer to everything else that goes on in a hospital as well. If we think about it, all the different things that have a data spatial correlation, it's pretty much everything. One article I read recently from Forbes says that 80% of an organization's data has spatial context. I believe it's even more than that. So once we have those in place, we can now start to support things like nurse call notifications, security, IoT platforms. The maps are the foundational layer to basically everything that goes on in a hospital. So here are some of those use cases that we talked about again. Giving security guards their own app that have maps in it. Did they actually walk the rounds that they were supposed to? Can we give them directions to an urgent situation? Temperature monitoring, so rooms that are storing medications that need to be at a certain temperature. When they go over that, we can visualize that on a map. Even things like logistics and inventory in a hospital managing, asset tracking, patient experiences in terms of wayfinding. All of those can be shared. We have one single source of maps that get updated in one place, but then distributed to any of the apps that might be, or interfaces that the hospital uses. So when we get that, we can enhance the patient and caregiver experience. We can have real outcomes. We can definitely realize workflow efficiencies. So now that we have true interoperability, we can unlock all these IoT cases we've been talking about. And over time, we can use it for analytics to uncover the patterns and insights that we wouldn't normally see until it's on a map.